My name's James Harris, and I'm an occupational medicine physician. I work in Portland, Oregon, and I've been doing medical arbiter exams for 10 years, probably more than that, on an intermittent basis for the Workers' Compensation Division. Well, from what I understand, the arbiter exams are scheduled always by Salem, the Appellate Review Unit. They're not the ones who come up with the idea, let's go get one of these, but rather it's initiated either by the worker or the worker's attorney or the insurance company or insurance company attorneys. And one of those parties is not happy with often the calculation or the documentation of impairment or lack of impairment. So one of those people will request a reconsideration of closure through the Workers' Compensation Unit, and they will do a careful file review to see if it was closed properly. That's not the arbiter's part. And then part of the reconsideration process, from what I understand, is re-looking at getting a second opinion, if necessary, about the impairment. Is it there or not? And if it is there, is it related to the accepted condition or to something else? Saying sometimes they're very simple, and the entire process, from interviewing the worker to examining them to finishing your report, can be done in 30 minutes. Sometimes they're very complex, and they can take 30 minutes, hour and a half, given the file review and the dictation and editing and so forth. That's one thing I like about the arbiter exams, is they're fair about it. If there's a lot of accepted conditions, the chart's really thick, you get reimbursed for that. It's not like one size fits all where you're banging your head on a wall that I just spent an hour and a half for a very small fee. So Appellate Review Unit is fair about their compensation based on those factors, how complicated the exam is, how big the file review is. So after the exam is scheduled with your office, the Appellate Review Unit will mail you the file that you're going to review. And as a top page has the appointment letter reminding you what time it is, as well as the scheduled fees. And then underneath that is the list of questions that could be as few as 4 or 5 or as many as 10 or 12. Basically, all the records that you need come from the Appellate Review Unit, and you don't have to do any request of records or digging for additional records. In fact, on occasion, a worker will bring more records for you to look at, and you have to politely decline that you're not able to look at them because everything has to go through the Appellate Review Unit. What you need to examine is outlined very carefully by the Appellate Review Unit. They had a wrist injury, we want you to do this, this, and this. It might be check range of motion of the wrist, check strength of the upper extremities, but they pretty much walk you through what they want you to look at to document any loss of use or function of an injured body part. Now that's kind of nice and a good advantage, because in other states, because workers' compensation, as you know, varies quite a bit state to state, they just kind of throw it to a physician, the attending physician or somebody, and say, just describe the impairment and rate it. And you have to be pretty familiar with a thick book written by the AMA, but in the state of Oregon, the rating of impairment, actually coming up with a percent of impairment, is done here in Salem by very intelligent but non-medical people. And they're the ones who come up with a rating. So the job of the arbiter, or even a treating physician at the end of a claim, is to just kind of document the loss of use or function. The issue is that the arbiter exam is a little bit more than just an exam, just measuring body parts or describing their function. The little bit more that it has to do with is, okay, now you documented the impairment. They lost some motion in their wrist, for example. Well, is that loss of motion in their wrist due to the wrist strain, or is it due to something else, like previous wrist surgery they had? So that issue is referred to as apportionment. And in the arbiter questions, they always ask at the very end, if you did document any impairment, well, is that due to the accepted condition or to something else? And if it is due to something else, tell us what that is. Another advantage of being a medical arbiter is the fact that you don't have a patient-doctor relationship and you don't have to see the patient again. Now, sometimes that's a negative because they're just charming people and they're very warm and that was a great encounter. They're just wonderful people. But on the other hand, you're never going to have that second time or third time in the office when you see somebody's name on a schedule and you slap your head and they go, "Oh, not them again," because they're only coming in one time. Even if they need a second arbiter exam for something else, it's been my experience they generally don't send them back to you. So it really is a one-time, see them, do a good job, don't see them again. I'd like to take a second and back up a little bit and kind of place the arbiter exam in a context. I think as many people know, workers' compensation claims get closed. They always get closed. That's kind of an important difference than regular medical care, where that can keep going on forever. The second thing that's important is people know that workers can have disputes during the course of their claim. Maybe the dispute is about they felt they got cut off from physical therapy. Maybe the dispute is they got fired from their work and they think it's due to the work injury. Well, those are an example of disputes that can occur that have nothing to do with the arbiter process. But a dispute that does involve the arbiter process is when they're concerned about claim closure process. Was it closed correctly? Or the worker may be concerned, or their attorney, that they didn't get back to where they were before the injury. And generally speaking, if you're here before you got injured and you're only here, this little difference here would be described as impairment. And that word impairment is pretty central to the arbiter exam. And just to review, many of the viewers would maybe know this, impairment could be defined as loss of use of a function of a body part or an organ system. That is in contrast to disability. Disability is different. Disability, I don't think I have a definition for it, but it looks at, can this worker do this kind of a job? It has to do with employment issues. And generally, the arbiter exams don't deal with that. Maybe one example that kind of illustrates the difference between impairment and disability would be loss of a small finger. Let's say I got an injury, maybe in my case would be a lawn mowing accident, and I lost my finger. Well, we could describe that in terms of what kind of motion I no longer have in that finger, or what kind of sensation I no longer have in that finger, kind of objective findings that describe loss of use or function of that finger, and that's impairment. Now, disability issue would be, can I do my job? Well, as a physician, I can do my job quite well with 9 fingers. I'm a lousy typist. I probably type just as badly with 9 fingers versus 10. But if I was a professional musician, it would make a huge difference. I could never go back to work. So that disability issue is important to recognize because generally speaking, the arbiters don't deal with disability, they deal with this thing, impairment. Well, with regard to where these workers are seen for the arbiter exams, if you have a regular practice, wherever that may be, they can be seen at your clinic at your convenience. Sometimes there's a need to have an arbiter exam done outside of Portland, done outside of Salem, in places where there's less physicians who are interested in participating and looking at the issue of impairment. So if you're interested in that, there's the possibility of doing exams out of town. Maybe you're going to Sun River for the weekend. What the heck? You might want to do an arbiter exam to help pay for your little mini vacation, but that's something that can be discussed easily with the arbiter unit about where their needs may be and if you're willing to travel a little bit and set up an exam outside of town. So some physicians really like that part of it as well. It's just a reason to get out of town, do something different, do something fun. So as far as payment for a medical arbiter exam, there's a few points worth noting. The first is, and perhaps the best one, is that the payment is guaranteed by statute. The insurer has to pay you. It's there on your appointment sheet. The prices that you'll be reimbursed are listed, not open for discussion or discounting, and the insurance company has to pay you for the arbiter exam, whether they requested it or not. And then the amount that you get paid depends upon, well, was it just a simple wrist strain, or was it an examination involving multiple body parts like the neck, the mid-back, and the low back? And in that case, your exam fees would be bigger. And of course, as far as the file review, whether it's 10 pages, would be paid differently than a thick stack over 500 pages. Well, another advantage of being a medical arbiter is that you only do an exam when you are available, when you want to do it. So if you're available, you would let the review unit know that, and they would typically call you or your office and schedule that in a couple of weeks out. So you won't get overworked. If you don't want to do more than a few a week or a few in a month, but it's totally up to your schedule, and then the worker will come to your office. Arbiter physicians frequently work alone and do what they would call a single arbiter exam. And if they're interested, they can let the schedulers know they're interested in doing a panel exam, which could be 2 doctors seeing the same patient, or sometimes 3 doctors seeing the same patient. That kind of a panel arbiter exam, from what I understand, is either requested by a worker's attorney or the insurance company's attorney, and I don't know the advantages or disadvantages of that, but sometimes we work alone or in a group. With regard to the impartiality of an arbiter exam, the physician to do the arbiter exam is picked by the appellate review unit. There's a process I don't know much about where sometimes different parties are allowed to not have that physician, cross their name off a list or something like that. But generally speaking, you're not chosen by the insurer, you're not chosen by the worker's attorney, but rather from the pool of arbiters, which we need more of, the appellate review unit picks somebody to do an impartial and thoughtful examination of the worker and answering of the questions. So that's very rewarding, and I always point that out to workers, because a lot of them had already been seen for an insurance-requested exam, and I just make it clear that I'm impartial. I'm not going to talk to you about what's accepted and what's denied and what kind of conflict there is there, but rather, how are you doing now? That's what the state of Oregon wants to know. And generally that breaks down a lot of barriers and walls, and things get a lot more comfortable. Another advantage of doing a medical arbiter exam, in contrast to an insurance-requested exam like an IME, is that there's not a lot of interface with the legal system. What I mean by that is that of all the years I've been doing arbiter exams, I've never been deposed about my findings or my thoughts on a medical arbiter exam. You're basically not required to participate in a deposition regarding your arbiter exam. Now, a little key to that is as long as you stay to the issues. But sometimes a physician may want to go on with other diagnoses they're making, some things that the appellate review unit is not really asking, and that could result in some contact with the lawyers to clarify your thoughts on that. So it goes a long ways just to pay attention to what you're doing and stick to the accepted conditions. Even attorney phone calls. For clarification, I've had attorneys maybe once or twice a year call my office, want to talk to me about an arbiter exam I did, and I just politely decline and steer them back to the appellate review unit, knowing that if there's something that needs my attention legally, I can address it then. But for the most part, particularly in comparison to other work involving medicine in the legal world, there's really none of that high-pressure contact that some physicians like me don't really like in a courtroom or doing depositions. And that's a nice part of it. I think I would just like to encourage the viewer, if they've watched enough of this video so far, to really consider helping out the workers' compensation system run smoothly and become a medical arbiter. Perform a medical arbiter exam. There's not a lot of long-term time commitment. There's no arduous training involved. And maybe after 1 or 2 or 3, you decide it's not for you, and that's fine. There's no contract or anything. But on the other hand, a physician may find out that this is kind of enjoyable, and it's a nice change or addition to my practice. So I would just encourage people to really consider it, and maybe at least give it a try and see how it goes, because it's really quite a bit of fun.